Welcome back to the Next Appraisal Tool modules. This module addresses question 7. Are the settings clearly described? Scientific articles should clearly state the setting where the research took place. Settings are important to help you understand to whom research results can be applied and the amount of control the researcher might have had over alternative explanations for the results. When appraising an article, identify where the study is taking place. Look for a description of the type of the organization. Is it academic affiliated? Is it private or public? Is it out in the community? Is it inpatient or outpatient? And then what type of unit or service line is it? Also consider geographical location. All of these differences can contribute alternative explanations for study findings. Researchers conducting studies in a laboratory have a great deal more of control over the setting environment, but studies taking place outside of the laboratory pose challenges for the researcher. When appraising an article, consider the number of settings. The more similar or homogeneous these settings are, the more internal validity the study. The more differences or the more heterogeneous across settings, the more potential threats to internal validity or the alternative explanations for study results other than the intervention. The number of settings is important because the higher the number of settings, the higher the risk of potential differences. The researcher needs to report how they address these potential differences across settings to reduce error or bias. Key strategies are to provide strict training for all study procedures from recruitment through data analyses. Those administering any intervention should complete rigorous initial training, and adherence to the intervention, also called intervention fidelity, should be monitored throughout the study period. Any deviations from study or intervention protocol should be identified early and corrected. A clear description of the setting is also important for external validity, generalizability of study findings beyond the study sample. You want to consider whether enough information is provided to determine if the results of this study might be applied to your patients. This is an example of a setting described by the author. Take a moment to read this, and when you're ready, move to the next slide. When formulating an appraisal response to this excerpt, the answer is yes. The setting is clearly described. Authors specify recruitment took place at 3 units in a large Midwestern teaching hospital, and outcomes were assessed in the patient's home following discharge. The intervention component, motivational interviewing, also took place in the patient's home, while the other component was text messaging. We have enough information to determine if this setting is similar to our own patient population. Congratulations! You successfully completed this module. You may return to the main menu or continue to other appraisal modules and the next EBP course.